Welcome to our education and health awareness on anxiety disorder. I'm Gayla Lee Chambers with Sierra, a senior at the University of Omaha studying in psychology. This short informational training session, you will learn more about anxiety disorders and how this diagnosis can affect your mental health.
So, what is anxiety? Anxiety disorders are a group of mental illnesses that cause constant and overwhelming anxiety and fear. The excessive anxiety can make you avoid work, school, family get-togethers, and other social situations that might trigger or worsen your symptoms. Types of anxiety disorders include generalized anxiety disorder, where you feel excessive, unrealistic worry and tension with little or no reason. Panic disorder, where you feel sudden, intense fear that brings on a panic attack. During a panic attack, you may break out in a sweat, have chest pain, and have a pounding heartbeat. Sometimes you may feel like you're choking or having a heart attack. Social anxiety disorder, also called social phobia, is when you feel overwhelming worry and self-consciousness about everyday social situations. You obsessively worry about others judging you or being embarrassed or ridiculed. Specific phobias, where you feel intense fear or a specific object or situation, such as heights or flying. The fear goes beyond what's appropriate and may cause you to avoid ordinary situations. Types of anxiety disorders continued are agoraphobia. You have an intense fear of being in a place where it seems hard to escape or get help if an emergency occurs. For example, you may panic or feel anxious when on an airplane, public transportation, or standing in line with a crowd. Separation anxiety. Little kids aren't the only ones who feel scared or anxious when a loved one leaves. Anyone can get separation anxiety disorder. If you do, you'll feel very anxious or fearful when a person you're close with leaves your sight. You'll always worry that something bad may happen to your loved one. Selective mutism. This is a type of social anxiety in which young kids who talk normally with their family don't speak in public, like at school. Medication-induced anxiety disorder is use of certain medications or illegal drugs or withdrawal from certain drugs that can trigger some symptoms of anxiety disorder. What are the symptoms? Panic, fear, and uneasiness, feelings of panic, doom, or danger, sleep problems, not being able to stay calm and still, cold, sweaty, numb, or tingling hands or feet, shortness of breath, breathing faster and more quickly than normal or hyperventilation, heart palpitations, dry mouth, nausea, tense muscles, dizziness, thinking about a problem over and over again and unable to stop, inability to concentrate, and intensely or obsessively avoiding feared objects or places. Don't procrastinate. Seek medical advice from your doctor for these reasons. Genetics. Anxiety disorders can run in families. Brain chemistry. Some research suggests anxiety disorders may be linked to faulty circuits in the brain that control fear and emotions. Environmental stress. This refers to stressful events you have seen or lived through. Life events often linked to anxiety disorders include childhood abuse and neglect, a death of a loved one, or being attacked or seeing violence. Drug withdrawal or misuse. Certain drugs may be used to hide or decrease certain anxiety symptoms. Anxiety disorder often goes hand to hand with substance abuse. Medical conditions. Some heart, lung, and thyroid conditions can cause symptoms similar to anxiety or make anxiety symptoms worse. It's important to get a full physical exam to rule out other medical conditions when talking to your doctor about anxiety. What is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. How do you know if your medical condition is affecting your mental health? Anxiety is the most common mental health disorder in the US. It causes both physical and psychological symptoms, and it can be very distressing. Anxiety can have a significant effect on the body. Long-term anxiety increases the risk of physical illnesses and other mental health conditions, such as depression. Where should you go for an assessment and/or an evaluation? You could go see your primary care physician, a licensed counselor, community health clinics, or your local hospital.
Our tip for today: if you are becoming easily irritated or frustrated with family and friends, take an assessment to see if you have anxiety disorder at www.talkspace.com. This concludes our education and awareness topics on anxiety disorder. I'm Gayla Chambers with Sierra. We hope this was helpful and that you have a great day.